So my name is Ricardo Baptista Leite. I am the CEO at HealthAI, the global agency for responsible AI in health. My background is as a medical doctor trained in infectious diseases. That was my first life. Then I was a member of parliament for 4 terms in the Portuguese National Parliament. I served as a deputy mayor and city councillor in my hometown. And my academic career has spanned across global health, health policy, in the frontier with digital. And in 2017, I founded an NGO called the Unite Parliamentarians Network for Global Health. So that's a network of current and former legislators around the world committed to science-based policymaking in 116 countries. In the AI space, beyond HealthAI, I also founded and chair the board of the Global Health Policy Lab, a collaborative between Charité and Harvard in Berlin that focuses using Gen AI for the generation and assessment of legislation in the field of health.
So cool. I could go down a number of different rabbit holes based on that background. But, here at HIMSS Europe, I believe you're up on a stage yesterday. Tell me a bit about what you're sharing with the delegates here.
Yeah, sure. And it was a great opportunity to be here in Paris at HIMSS to showcase a bit of the work we're doing as the global agency for responsible AI in health, HealthAI. But I tried to position our work in a wider frame, in the sense that the discussions we've been hearing a lot about is the potential transformation that AI will bring and a lot of the hype. But fundamentally, it's critical that people understand why they want to use AI. And so many times, since I work with governments around the world, and I tend to work with different kinds of stakeholders, many times people say, we want to use AI. And I ask them, why do you want to use AI? And the most common answer is because my boss is telling me I have to do something with AI, and which is not the best approach. No. We need people who have vision. They know where they want to go. If they don't know where they're going, any road will take you there and not necessarily will improve outcomes. Actually, and I was telling the audience yesterday that 20 to 40% of our health expenditure today is being used and wasted on things that do not contribute in any way to improving outcomes. And so that's $3 trillion alone globally that is being wasted. And so AI is such a transformative technology or group of technologies that the opportunity is to redesign, to reimagine health altogether. Today, we, especially in the richer countries of the world, we have broken disease-driven models that focus on disease, that make disease profitable. How do we change the whole incentives model so that we focus on quality of life, well-being, on prevention, on longevity with quality of life? And AI has the potential to be the driver as long as the leaders know how to take it there. And at HealthAI, we're helping governments build the governance ecosystems so that they can assess these technologies, and most importantly, they can scale the technologies that work to provide that kind of transformative impact that we are all striving for.
Yeah, it's thinking about those incentives. I'm reflecting on some of that. Some of it comes from the, in the startup world, the investment side. It's almost like you need the AI on your pitch deck to be able to, bring revenue. And then in the reality of speaking to clinicians on the front line, probably it's not the first thing on their list of saying, I just want to put AI. And in the end, they want to deliver good patient care. They want to have systems that work properly and a lot of those kind of fundamentals. So it's interesting thinking about, how AI is going to have a real practical, application to that. Interested to learn more about HealthAI and the that role of, bringing you were mentioning government and policy, and so they're all important parts. But to be able to corral that kind of network, particularly and have influence at a global scale, unpack that a little bit and tell me about the why and the how of HealthAI.
Right. Well, the why, I think, is pretty clear in the sense that what we're seeing now is many countries, the richer countries in the world, you have tons of pilots, but very few are scaling to systemic transformation. And there's a fundamental belief that there are many issues behind that, but the lack of governance leading to lack of capacity in the governments, leading to lack of trust of the different components of the system to address these technologies, the lack of even health technology models to reimburse these technologies, all of this is holding back the intelligence revolution in the field of health. And so fixing that is a priority for us so that we can see this technology have the impact for every citizen everywhere. But for that to happen, it can't be something focused just on richer countries. The low and middle income countries of the world are actually the ones that, in our opinion, stand to benefit the most from the intelligence revolution because they can see their health systems leapfrog. They can actually reimagine how to deliver health and care altogether without the legacy systems that in these disease-driven models of the Western world have taken over and that have made health systems basically unsustainable. And so working with these countries to make sure that they have their sovereign independent capacity also to make the most of this intelligence revolution is critical for us. But as you were saying, for this to become real, you need people. You need the citizens, you need the patients, you need the people who you want to serve. And so we're doing two things, I would say, that are the main pillars of our activity at HealthAI. One is a community of practice that any institution is free to join. It has a leadership group of 25 governments that is growing, more than 300 institutions. Anyone who is interested as an institution can go to our website at healthai.agency and apply. And it includes academia, it includes international organizations, but it also includes a private sector, it includes civil society, patient organizations, because we find it critical to bring all of those voices together. And for us, it keeps us grounded in the sense that we hear from the people who are actually either developing technology or benefiting from it or somehow in this ecosystem, giving us feedback on what is happening on the ground because it's such a fast evolving technology that thinking that we know everything today and that we don't have to evolve along with the technology in terms of governance and regulatory frameworks is just madness. And so we created this feedback mechanism from the ground up, and we believe in this bottom-up approach to be critical. The second component that is critical of our work and also addresses the global outreach that we need to achieve as an agency is through our global regulatory network. So this is a network that brings together government agencies and regulators that we're starting off with 10 pioneer countries from across the globe, a mix of high, middle, and low-income countries that will be announced after the summer. And that these 10 countries will be the first 10 countries where we will be doing our implementation work in terms of building their regulatory capacity, providing them with the maturity journey, but also as soon as they join that network, they'll have access to the global early warning system. So this is you can imagine it as a post-market surveillance sentinel system. So if there's an AI tool that presents risks or harm in Singapore or in Zambia or in Brazil or in Switzerland, everyone gets a red flag in real time, helping build trust. And also, we already have a beta version of a global AI solutions repository. So you can think of it as a marketplace. As the regulators approve tools for their markets, those tools will appear on this one-stop shop where everyone can see what technologies are out there, who developed them, and which regulators have already approved them for their own markets, hopefully helping technology expand beyond the borders where they were developed.
Yeah. Hey, on the regulatory side for AI, it's been great that I've been able to do so many interviews here, but I wasn't able to jump in and catch some of the sessions yesterday. As I understand, there was quite a lot of discussion around artificial intelligence, obviously, but specifically regulation and the AI Act in the EU as well. And I reflect on my own kind of experiences and the impact that, say, GDPR had back on security globally, despite it being like an EU-specific kind of policy. In order for companies that want to deliver services globally, they're obviously going to need to have compliance with GDPR, and so everyone kind of went backwards from there. I even think in Australia, we've got Australian privacy principles and all of this, but if you're going to be, it's a level up for GDPR. Now the EU is doing, something like the AI Act. Are we thinking that we're going to be following a similar kind of path in that if you're going to be utilizing AI, regardless of if you're in the EU or not, you're probably going to want to align with what's happening in the AI Act? Am I on the kind of right path there?
Well, with GDPR, you did see that phenomena happening.
Yeah.
There's an expectation in Europe that also the European health data space approach will be one to follow when it comes to data sharing across countries, which is a critical challenge for the success of the intelligence revolution. The AI Act has that potential as a risk-based model. Let's see how it plays out. I think that the effectiveness of the policy will then be a precursor for its potential expanding or exporting to become a reality in other contexts. We as an agency are strong believers that anyone that tries to force a one-size-fits-all approach is deemed to fail in this space. The current context, the polarization, even in the political context, the different ideological backgrounds from governments, the different cultural perspectives on AI in general and on regulation, you cannot try to force everyone down the same path. So what we try to do is we try to tailor our technical assistance. Of course, our starting point is responsible AI principles and international guidelines and standards. We don't invent these things. We work with international guidelines and standards, but then we adapt them to the local context. And so understanding what the government's approach will be. And I believe if we do this in a way that is collaborative, eventually we will have some form of alignment down the road. And that is much better than what we're living today, which is the Wild West, where everyone's kind of doing their own thing, where there is tremendous fragmentation, which makes it impossible, especially for small and middle enterprises that are developing AI technologies, to expand, because just the legal complexities of getting into different markets is becoming a nightmare.
I feel like there's a sense of urgency about some of this too. I look at specifically utilization of AI scribes, and I know in Australia, but globally too, it's one of those, not rare times, but it's an example of technology where I know clinicians have adopted tools because they've seen an immediate benefit, and it's for all good intentions of, I can reduce my admin time to see more patients and maybe even more accuracy and deliver better care. But it's kind of like the shadow IT approach sometimes for some, or it's just hey, this is what we're going to do. And then organizations and health institutions just need to keep up. And it feels like the industry wants more time in order to work out what we do. But I feel like that's perhaps one luxury we may not have if there are more examples of how, something like a large language model may assist in other areas, and then we start getting into the diagnostics piece and everything. So I guess there is a sense of urgency around this too, right?
Well, absolutely. And I would say that the industry is now facing a very challenging moment, because a lot of investment has been put into R&D, into developing pilots to prove that their technology is effective, that it's safe. But then, billions being used to develop technology, who's going to pay for it? And in health systems, that depends in most cases of defining a reimbursement model, which in most countries is non-existent for these technologies. Everybody finds them fascinating, good to have, but when push comes to shove, is it worth it, the investment? And with so many priorities, it sometimes falls in the middle of the cracks. Yeah. And the tremendous benefits that these technologies can bring are forgotten in that discussion. So creating that kind of HTA model on health technology assessment is, I believe, one of the critical elements that we're focusing on. The other thing is a bit more of an ethical conundrum, which is the way regulation has been designed over decades is every time a new technology comes in, it is compared with the gold standard of treatment or care or diagnostic or whatnot. The thing is, we have to be real. And being real means, in many parts of the world, the gold standard is non-existent. So the question is, with AI, we can give access to better health outcomes. It's not probably as good as perhaps in comparison to the gold standard. But if we always demand that something that is new is better than the gold standard, then that technology will never reach those parts of the world. So is it ethical to keep people with not having access to care instead of having access to AI tools that can improve their outcomes? And so when the option is between AI and nothing,
yes,
even, if the risk-benefit ratio falls more on the benefit side, perhaps that's the way to go. And that's why I'm a strong believer that the future will be very much driven by post-market surveillance. We cannot expect to identify all of the potential risks preemptively. We should do a good job as much as we can to approve these technologies, ensure they're safe before they go to market. But the most important part with AI is the post-market surveillance, identifying through real-world data if something goes off. And to detect that early on, that's in the interest of companies to avoid legal liability and reputational risk. It's in the interest of those managing the health system to avoid harm to patients. It's the interest of everyone to build trust towards these technologies. And so that's a mindset shift that I think is also fundamental, along with the transformation of healthcare and altogether in terms of using AI to basically go from that disease-driven model to one focusing on well-being.
Yeah, I love that you addressed that point specifically, because that was literally going to be my next question, discussion around the point of, is something AI better than nothing at all in some of those developing regions. So I love how you think about that. Reflecting then on, I guess, the complexity or the how some of these issues can almost feel a little bit nebulous, or bit like they're so big sometimes for those that have a lot of healthcare to do today that there might be some resonance in terms of what you're saying. Oh, yeah, I agree, but it's kind of like, what do we do about that? So what would you hope that participants and here at HIMSS Europe are attending and catching sessions? The real value in attending some of these is then what you do about it afterwards. Right. For a global agency and it's hearing about it first time, is it something that hospital CIOs and policymakers are worth checking out, or is it the frontline clinicians? Like, what should people do with this information now in order to have an impact within the health system?
Well, I think the starting point can be the community of practice and the different stakeholders working in this space, because it's really a space for discussions, to be part of the conversation in a multi-stakeholder environment, to hopefully not only listen in, but also contribute with perspectives, with questions. And it's interesting to see, from different parts around the world, we have that privilege of being from this global perspective, where you see that no matter if you're a high income or a low income country, if you come from the provider side or the developer side, the challenges are overlapping in many ways across the globe. And so hopefully we are doing our small part to contribute to bringing those different stakeholders together so we can find those solutions. And so I honestly think reaching out to us, being part of that community, being part of that conversation is a great way to start to be engaged and hopefully help us and help the world shape what the role of AI will look like in the future.